Hello! In today's video, I'm going to touch on skin aging. And skin aging is a very big topic, and there are many factors that determine how we're aging and how fast we're aging. And one of them is menopause. And due to the life expectancy in most countries, it's estimated that women are going to be spending 1/3 of their life in menopause. So it's definitely a topic worth addressing. So my aim today is to give you a scientific overview about what is happening and share with you some advice on how we can slow down skin aging as a result of menopause. So, in general, the skin aging process has two main categories. On one hand, you have extrinsic aging, which is aging that's caused by external factors, so UV radiation, pollution, lifestyle, smoking, diet. And then on the other hand, you have the intrinsic factors, and so these are things that are happening naturally as you age, and they're genetically determined, and they're often a result of hormonal changes. So menopause is falling in this intrinsic aging category. And with menopause, you have a huge hormonal change, which is a huge drop in estrogen, and this causes many changes in your skin very, very rapidly. So estrogen does play a role within your skin cells' activities. And this is because there are estrogen receptors in your dermal fibroblasts and your epidermal keratinocytes. And what receptors are molecules that are able to bind the estrogen hormone. And when this happens, the cell's activity changes. So within your skin, estrogen regulates sebum production, it regulates collagen content, it plays a role in the glycoaminoglycan content, and these are water-binding molecules, so notably hyaluronic acid content, and it also plays a role within wound healing. So when you enter menopause and your estrogen content is dropping a lot, and this is dropping from your ovaries as well as in the hypothalamus in your brain, you no longer have the estrogen binding to the estrogen receptors in your skin, and so you see a lot of changes very quickly. So when you enter menopause, you're often seeing a decrease in collagen content, and this can be quite dramatic. It's estimated that most women lose around 30% of your collagen content within the first 5 years of menopause. And this also has the effect on your elastin content, so the elasticity on your skin is also decreasing. And there's also a decrease in the glycoaminoglycan content, so your skin's ability to retain and bind water is impacted. There's less sebum production, so your skin becomes very dry and your skin barrier can become impaired. And you also have changes in your wound healing ability, so the skin's ability to heal itself quickly as a result of certain skin lesions is impaired, and you can often get redness and inflammation. So overall, what this means is that when women enter menopause, they often see a large increase in skin wrinkles, sagging, dullness, texture issues, pigmentation issues, and dryness very, very quickly. So when looking to treat the intrinsic menopausal causes of aging, so menopausal skin, there's the option to go on hormonal replacement therapies or to apply estrogen topically to your skin, but this needs to come from a dermatologist. But you can also find some very, very advanced cosmeceutical products that are specifically designed for menopausal skin and are specifically designed to help overcome this estrogen deficiency in your skin. So I'm going to briefly discuss, our favorite example with a really advanced technology from a brand called Emepelle. So the reason that the brand Emepelle is so amazing for menopausal skin is because it contains an ingredient called methyl estradiol propanoate, so MEP. And what this molecule does is it actually interacts with and binds to the estrogen receptors within your skin to stimulate certain cellular activities. But then after this, the molecule is completely inactive, so you don't get any of the side effects that you would normally have if you were on a hormonal replacement therapy. And so this technology, the MEP technology, is incorporated into a serum and a night cream from Emepelle. So the Emepelle Serum is an oil-free lightweight serum that you can use in the morning and in the evening. It contains 1% of the MEP technology. It also contains niacinamide, which supports your skin barrier, helps with collagen production, helps with hyperpigmentation and uneven skin tone. It also contains antioxidants, so vitamin C, vitamin E, and ferulic acid. So this helps protect against any oxidative damage to your cells that comes from pollution or from UV damage. It also has a few peptides in there that help diminish wrinkles. And then lastly, there's hyaluronic acid. So this helps restore the glycoaminoglycan content within your skin and increase the water binding capacity. So that's the serum. And so there's also the Emepelle Night Cream, which contains 2% of the MEP technology. It also contains hyaluronic acid. It also contains a low percentage of retinol to help stimulate cell renewal and help reduce wrinkles. It again has the peptides in there, which also help reduce wrinkles and restore elasticity. And then it's very rich in emollients, so it helps protect your skin barrier and retain moisture within your skin. So, Emepelle has also been extensively studied scientifically, and one study that I will mention was on 14 women who were all of menopausal age, and they used a gentle cleanser, Emepelle Serum in the morning and in the evening, Emepelle Cream in the evening, and an SPF 30 during the day for 20 weeks. And what's so great about this study is that after 20 weeks, women saw significant improvement in their skin hydration, improvement in wrinkles, improvement in texture, improvement in tone, and overall the patient satisfaction was very high, and women said their confidence was increased because their skin issues that were related with menopause decreased. So, Emepelle is a really fantastic topical solution that we would recommend to anyone who is approaching menopausal age or who is already in menopause and you're looking to address certain skin issues. But another solution that I'm really briefly going to mention is a nutritional supplement called Skinade. And Skinade contains many nutrients as well as collagen peptides, and it's able to stimulate collagen production within your skin. It comes in pre-mixed formulas, which are specifically designed to enhance its absorption in your body. And essentially it's the equivalent of taking 20 nutritional supplements all in one, because what you're taking is actually being absorbed through your gut and getting into your skin. So it's also a very sophisticated formulation. And what I would really recommend is that if you would like to see big changes in your skin, stop what you're doing, use a gentle cleanser, use Emepelle, use SPF 30, and take Skinade for about 8 weeks, and you will absolutely see changes in your skin. You're going to see, brighter skin, more hydrated skin, and you're going to see a reduction in fine lines and wrinkles. So that's the brief discussion on aging today. We will have more videos about skin aging, talking about other intrinsic factors and some more of the extrinsic factors and certain things you can do to improve aging. If you have any questions on what I mentioned today, so any questions about Skinade, Emepelle, or what you should do if you're approaching menopause, please feel free to leave us a comment below, because we're always looking at these. We have our Instagram, Dermoi Skin, and you can connect with us on there. And we also have our shop, which we try to give the most up-to-date information. So thank you for watching.